Welcome to the Baby Playbook podcast. It's so great to be with you. It's been so fun getting back into the year and getting some really amazing experts on the podcast this year, just to really delve into all these different topics when it comes to baby and pregnancy, birth, all different things. And today we're going to really focus in on something that a lot of parents do actually need to deal with when it comes to a baby. And I want to preface this both with a bit of a story. I think for me, when Noah was born, my eldest, the thing that I very quickly realized in the chaos of like a newborn mess was that it felt like everything that he did was connected. So, you know, if he didn't feed properly, he didn't sleep properly. If he didn't sleep properly, he didn't feed properly. You know, all those things started to really become obvious that everything with a baby is really connected. And when everything kind of runs smoothly, which it doesn't a lot of the time, you know, you start to realize the techniques and things that really help settle your baby at different times when it comes to sleep, when it comes to rest, when it comes to playtime, and when it comes to feeding time as well. This is also something an amazing Perth-based dentist has realized, Dr. Shereen Lim, who joins me today. Thank you so much for joining me, first of all, Doctor.
No, thanks very much for having me, Nicolina.
Now, you are the author of Breathe, Sleep, Thrive, and this is exactly what you've kind of been focusing on. You've been helping parents really recognize and resolve the root causes of feeding and breathing difficulties, which of course in turn have that effect on sleep. Everything is so related when it comes to babies and kids, and this is something you very much realize. So how did you, I guess, just first of all come about this? You're a mum yourself. How did it all first start to make sense for you?
So my interest in airway and sleep really began with my husband snoring. It was about 15 years ago, and his snoring was driving me really crazy. It was disrupting my sleep. So out of frustration, I got out of bed and I decided to learn more about dental appliances that could be worn overnight to help alleviate snoring. And I decided I was going to help more spouses in this same way.
Amazing.
Yeah, so I decided to enroll in a graduate diploma in dental sleep medicine and became involved in treating adult snoring and obstructive sleep apnea. And looking at this issue with dental appliances, they move the lower jaw forward to help open the airway during sleep. And so what we're really doing is we're really masking or addressing a symptom of poor jaw development. How come we can't grow jaws more rapidly in the first few years of life when we're growing? And so that's when I became more involved in early interceptive orthodontics, but really to try to understand that poor facial or jaw development is really a symptom of oral dysfunction. So when the muscles of the mouth don't work well in the earliest years of life, when the jaws are growing the most rapidly, that is going to alter the way that our jaws grow. And in turn, this is going to alter the way that we can breathe and sleep for life. So that's why I became very involved, seeing those problems down the line. How can we minimize that in children? How can we change that trajectory and promote good oral function early on? And that includes nasal breathing 24/7.
Yeah, right. It's really, really interesting. And as you said, it's all really connected. And I guess if you start to really focus on this in those earlier stages, you give yourself the really best chance of, you know, making sure that bub into toddler, into child, into adult sleeps well and is resting well. Now, one of the things that you, of course, I guess, come across with families with all different things when it comes to, I guess, jaw development and mouths and things like that is, of course, tongue tie. And this comes up for a lot of families very, very early. You know, I think even I have some friends in the hospital, you know, they're told, oh, I think the baby has a tongue tie. Can you explain a little bit about what tongue tie is and I guess what it affects?
Great. So really, before going into tongue tie, when we talked about oral dysfunction, one of the key first warning signs is breastfeeding difficulties. So first of all, I want to let people understand breastfeeding. As much as we appreciate the immunological and nutritional benefits, there are some mechanical benefits with breastfeeding. So in order to breastfeed, really, we need optimal tongue function. So that tongue is lightly suctioned to the roof of the mouth. It creates a vacuum. And as the tongue lowers, that's how milk is transferred the most effectively. And it actually promotes good jaw muscle movement. So the jaw needs to go back and forth. So it's stimulating our jaws to develop wide and forward, which is really good for our airway and breathing. And so really, some of the most common reasons for early cessation are poor transfer of milk or the perception of low supply and pain. And so tongue tie is a contributor to those issues. So when we have a tongue tie, it's when the attachment between the undersurface of the tongue and the floor of the mouth is unusually short, thick, or tight, and it restricts normal movement of the tongue, which includes that elevation that is required for good, efficient transfer of milk and good swallowing as well. And so when we have that, we have altered mechanics of the breast. And for some people, it may not create a lot of symptoms. For some people, it may be pain or poor transfer of milk. And some babies just learn to compensate. So even though their tongue is not functioning, they start to overuse other muscles of their mouth. So it's very variable in terms of its presentation. We're not given a lot of training with it. You know, even as dentists or oral physicians of the mouth, we're really not taught about tongue ties or really how the tongue is supposed to function. But yeah, this can lead to the dismissal or under recognition of this being a root factor. And in fact, we now know that there's quite a bit of research to suggest that when we have a tongue tie and it impacts swallowing, babies can take in a lot of air, and some of them will have reflux-like symptoms. And if we give reflux medications, they're not necessarily going to be effective if the problem is swallowing of air. Yeah. So a lot of these babies, they may just have stomach distension or just really fussy on feeding. And even if they're not breastfed, even if they're on the bottle, they can be impacted by these symptoms as well. They just tend to be very uncomfortable, arching on and off, spillage of milk. And, you know, they may be more prone to things like spit ups and vomits and just being really unsettled. It can disturb their sleep. It may affect them, you know, down, you know, even a couple of hours after the feed as well. So I think it's an important area that we are not given a lot of education on. It can get very missed. People can go for multiple opinions. So it's something that parents should be aware of so they can feel empowered to ask for assessment.
Yeah, certainly so. And that's the thing, I think, especially with being a first-time parent, I know you would probably remember this as well, is like there's all this information thrown at you, and then like a lot of it is different. It starts at the hospital with like every midwife having a different opinion on feeding and all different things. Yeah. And so it is really easy to, I guess, you know, and it starts to kind of really build, you know, it might be feeding difficulty into they're not sleeping and you're not sure what's related to what. So that can be really overwhelming for parents. So it's nice that we're talking about this because I guess, as you mentioned, it might not be something that's picked up if you first flag it with whoever it may be. Maybe it's your maternal health nurse, or maybe it's your GP or pediatrician. So perhaps hearing this podcast, many people can actually ask those direct questions of, could this be tongue tie? Could this be, you know, could this all be related and affected? Can I ask then, moving from, I guess, once a baby could potentially have those problems and start to pick things up, how can we, first of all, what are the signs that we're looking out for? And then how can correcting this really help them in the short to long term?
Yeah. So as I mentioned before, just because of our capacity to compensate and use other muscles, there are many presentations. And so not every baby is the same. But little red flags that I would look out for is if there is any pain with the latching, if there's constant pulling on or off, on and off, if there is air intake or clicking, where babies are sucking in air and they're very uncomfortable, poor weight gain, which could be really related to the poor transfer of milk. Many times parents can pump and get adequate volumes, but the babies have trouble actually extracting it. They may be slipping on and off. It may be a weak latch. So I really want to see, ideally, whether it's breast or bottle, baby being able to open their mouth and get their lips around to get a good seal and to get their tongue working well. Things like nipple shields, they promote compensations where babies aren't really able to use their mouth correctly. So whenever there are issues, the most important person to be able to consult with is an international board certified lactation consultant, an IBCLC. They have done further training in lactation support for both bottle-fed and breastfed babies. But the thing is that, again, it's one of those areas that doesn't get a lot of training in our programs. And so there are differences in those IBCLCs. Some would have done further training on tongue tie management and some are less on board with it. They're more interested in whether a baby is getting good weight gain and not pain. And they may introduce different compensations, like how to hold a baby or do little awkward maneuvers to promote breastfeeding. But someone who has special training in this area, who has experience in an integrative team approach to work with providers, even manual therapists like chiropractors and osteopaths, they can have an important role in helping to promote good feeding and latching. And so one of those professionals would be a really good starting point.
Yeah. Okay. Amazing. What can I ask you as well, Dr. Lim, when it comes to a tongue tie, a lot of parents would obviously be very I assume it would be really confronting being told, they have a tongue tie. And even though believe there's a laser surgery you could, not a surgery, but like a procedure you can do to fix it all up. What do you tell those parents that are a little bit hesitant, I guess, to get that particular support with their tongue tie?
Yeah, I think the first thing is really to work with one of those lactation consultants, not necessarily jumping in to address that. Usually when I work closely with one particular lactation consultant, that she's really in tune with body restrictions and how tight babies are. A lot of babies that, after birth, it's quite a traumatic process. Even the way they sit in utero, there's going to be restrictions in their bodies, which can actually impact also their positioning and even their tongue mobility. So sometimes she'll just give them body exercises or refer them to the various people that can help out address the body. Then, we'll look at the positioning and like the bottles and the latch and give oral exercises, because when we release a tongue tie, for instance, it's like having a cast on your arm. Just because we take that off doesn't mean everything's going to function really well, especially when you've gone into utero and you've had altered sucking and swallowing. You need to relearn things. So she'll do some sort of functional evaluation and give a score looking at how well the mouth is working and trying to get some progress first with non-invasive interventions. We really don't want to jump in necessarily. So when parents have concerns, they've done a few things, they may have noticed some improvements, generally speaking, and there's still some persistent areas. That lactation consultant can tell them where they think the latch could be better or what could be improved. And that allows people to make a fully informed decision, ruling out the non-surgical interventions first and getting the improvements, so that this is almost like the last thing that we're managing.
Yeah. Can I ask, of course, with this, what we've been talking about, difficulty with breastfeeding, tongue ties, that stuff can become quite apparent at the start, but it is a bit of a chaotic time. So what about for those families who have older babies? Of course, on this particular podcast, we really focus in on the 0 to 12 month mark. What are some signs on older babies or even perhaps toddlers where it could be a case of, this was really missed, and this could be having an effect on sleep, on feeding, on, even starting solids at the 6 month mark? What are some of the impacts it can have in those areas?
Yeah, really the most important thing we want to promote is good tongue elevation, right? A lot of people, for instance, might say the tongue can poke out adequately, there's no tongue tie, but really that's not enough. We need that tongue elevation for good sucking, swallowing, speech development, articulation, to promote good breathing. So if we want to breathe well, we should breathe with our tongue up, mouth closed, through our nose. Good palate development as well. We need that tongue up. So what are the problems when it's missed that we might see? Again, there's so many compensations. People can use other muscles and develop ways of doing things. So it's not always going to play out the same. But I would be looking for things like children who can't really manipulate their foods. They don't really swallow their foods. They may spit it out, or they may have to use their hands. They may be more picky with their foods or selective. They may not want the more chewy foods, or they may be more prone to gagging. Things like children who may have speech delays or difficulties with their speech articulation. They may have more lisp because their tongue is sitting low and they're not able to, they're not used to lifting their tongue. And mouth breathing as well. So as a child has lower tongue posture and they keep their mouth open, they're going to form a mouth breathing habit as well. So we know that the optimal way to breathe is through the nose. Yeah. And if we have our mouth open, our mouth closed, and we try to snore, it's easier to snore with your mouth open. And that snoring is really a sign that there's increased resistance to airflow. Airflow is not as smooth. And we now know that there are risks associated with chronic mouth breathing.
Yeah. Isn't it? And you know what? It's become, I don't know about you, but I feel like it's become quite a thing in the last year. I get all the Instagram ads about like mouth tape, sleeping with this and that. But it's, now that what I'm gathering as well with what you're saying is this is all things that I guess are like, okay, pop the mouth tape on and that'll help with it. But it's not actually really looking at the root cause of why it's happening and what can we do to fix it, which is quite interesting.
Yeah, because really, if there's one takeaway for parents is that we want to try to get children to have closed mouth nasal breathing with their tongue up as they develop, because that really promotes good jaw and airway development. And those facial structures are growing the most in the first 6 years of life. If we have open mouth, tongue down, mouth breathing, we're going to get more narrow mouths and more recessed jaws, like a longer face rather than full and forward. So when that happens, when we have a narrow mouth, that's a narrower nasal passage, less room for the tongue. And then as our jaws get more recessed, that is also encroaching our airway space. We're going to have a more pinched airway. So that's what we do as adults with snoring and obstructive sleep apnea. One of those interventions is, can we bring the lower jaw forward to open up the airway? But that's only at nighttime. How about 24/7? Can we get the face to grow well during the earliest years of life? And so really, we want to promote that nasal breathing.
Yeah, certainly so. Can I ask you, Doctor, I think for parents, especially during this really, really overwhelming time, when you are seeing, all these people, whether it is a lactation consultant, you go to the GP and perhaps like you've heard about this, it can be really hard to kind of advocate for your child or yourself when it's not really, and it seems like it isn't really at, this sort of stuff isn't really at the stage that it's very commonly looked at. And as you mentioned, it might take a couple of specialists, a couple of appointments to really get to that root cause. What do you say to parents about just making sure that they advocate for their child? If they're noticing these things, it's okay to ask for help. It's okay to, continue to push to see whether they need to be, tested for particular things, because that can also be quite hard. Sometimes you just think, oh, okay, well, it must not be anything because I guess that's what I'm being told.
Yeah, for me, it's really sad because people struggle with a lot of problems that sort of get dismissed as well. And then parents start to doubt themselves. Also. And it creates a lot of problems in the home where dad might say, can you just put this to rest now? It's time to move on. And then parents doubt themselves. And I would say to really understand that parents or mums in particular, they really do have a good gut sense.
We do.
So just to kind of follow that and really recognizing, gosh, it's so variable, that knowledge is so variable, trying to look for people that do have experience in this area, because I've seen people that have gone and seen like 12 different people and just really had their concerns really underplayed or dismissed. So really to recognize as a parent, I would even say that sometimes it's considered controversial. People don't really want to look at this option. They think there's not enough evidence for it. But when there are ongoing problems that really aren't getting solved, sometimes we need to look outside the box and see what else is possible. What have other people noticed as well?
Yeah, certainly. So, and thank you so much for sharing, because again, this is something that I guess many people might not have heard of or might not have had the chance to look into. So it's nice to just know. And that's, the point of the podcast is things like this to have in the back of your mind in case you start to notice these things with your baby. And you can, of course, start to ask those relevant questions. If people would like to get a little bit more information, thank you for sharing. They can connect with you, Doctor, on Instagram, of course, at dr.Shereen Lim. I'll pop that in that link in the show notes so that they can click on that. Your book, Breathe, Sleep and Thrive, which I have a copy of, is great. So make sure you grab a copy of that one, parents, to have a quick read of, even before baby comes, or maybe whilst you're in the newborn mess and you think something's going on. And your website is drshereenlim.com.au. It'll all be linked in our show notes. Thank you for providing such great insight. And I hope you are getting some sleep now with your husband next to you with the snoring situation, because we all need that, babies or not.
No, thank you.